Welcome to Sleep Explained with Fred. This is Fred. Fred can fall asleep almost anywhere. I'm sorry, Fred. It's true. He can fall asleep on the couch, at the movies, while waiting for an appointment, sometimes even in the middle of a conversation. Fred thinks this means he is an excellent sleeper. But Fred isn't sleeping well. He is sleeping often because his sleep may not be doing its job. Every night, Fred goes to bed and quickly falls asleep. Soon, he begins to snore. Then, without realizing it, Fred stops breathing. His chest continues to move, but air is no longer passing through his throat. After several seconds, Fred makes a loud gasping sound and begins breathing again. Fred doesn't remember any of this, but his wife does. She watches this happen over and over throughout the night. Which brings us back here. She convinces Fred to speak with his doctor. The doctor says there are two main ways to diagnose obstructive sleep apnea: a sleep study in the hospital, or polysomnogram, or a home sleep apnea test. No matter which test you have, your results will be displayed as an AHI, or apnea-hypopnea index. Less than 5 events per hour is no sleep apnea. 5 to 14 events per hour is mild, 15 to 29 is moderate, and 30 or more episodes is considered severe. Fred's AHI was 22. So what do we do now? Your doctor will look at your AHI, risks, symptoms, and oxygen nadir, or lowest oxygen during the study, and develop a treatment plan. The treatment plan will be individualized, but will likely be one of the following. If applicable, your doctor will talk to you about weight loss, sometimes in conjunction with a dental device. Assisting weight loss with newer medications like Zepbound is also an option. Even though implantable devices like Inspire are available, they are not for everyone. Most people will likely end up on CPAP, which stands for continuous positive airway pressure. There are actually 3 types of positive airway pressure: APAP, BPAP, and CPAP. APAP actually being the most common. You got all that, right? Well, let's try it this way. Think of a garden hose. When you are watering your lawn, one constant flow of water comes out, right? Well, that's CPAP, a continuous flow of air measured in centimeters of water. Well, what about APAP? Imagine APAP like someone adjusting the flow of water based on need. This doesn't happen from breath to breath, but rather over time. So just to recap, APAP, the A standing for automatic, will gradually increase or decrease flow based on need. The need being how much pressure is needed to overcome the obstruction. A normal prescription may sound like 5 to 12 centimeters of water. Jumping to CPAP. CPAP will provide one continuous pressure. A normal prescription will sound like 7 centimeters of water. BiPAP, or BPAP, is a bit more advanced and just means you get a higher pressure on inspiration and a lower pressure on expiration. A normal prescription will sound like 12 over 8 centimeters of water. That's the brief explanation. Please always consult your doctor for all medical questions. This is meant for educational purposes only. We will come back and visit with Fred once his CPAP machine has arrived.